Dear colleagues, my name is Thaci. I am University Professor at Institute and Comprehensive Center for Inflammation Medicine at University of Lübeck in Germany. I'm very pleased on behalf of my colleagues and co-authors to present and to show you the manuscript entitled 5-Year Efficacy and Safety of tildrakizumab in patients with moderate to severe psoriasis who respond at week 28, pooled analysis of two randomized phase 3 clinical trials, reSURFACE 1 and reSURFACE 2. Long-term efficacy and safety data of biological therapies are crucial to inform clinical practice. Tildrakizumab is an IL-23 P90 inhibitor approved for the treatment of moderate to severe psoriasis, and 3-year data has been previously published in British Journal of Dermatology. This analysis presents final results from 5 years of continuous tildrakizumab treatment of week 28 responders, the longest follow-up investigation to date of an anti-IL-23 P90 antibody with more than 5,400 patient years of total tildrakizumab exposure. Data are reported from two phase 3 studies, reSURFACE 1 and reSURFACE 2. These were double-blind, randomized control studies with optional long-term extension. Efficacy outcome included proportion of patients achieving absolute and relative improvement from baseline psoriasis area and severity index score through week 244 in tildrakizumab responders, continuously receiving the same dosage of tildrakizumab, 100 milligram or 200 milligram every 12 weeks, and etanercept partial responders and non-responders switched to tildrakizumab 200 milligram at week 28. Of tildrakizumab 100 or tildrakizumab 200 milligram responders and etanercept partial responders or non-responders entering the extension and evaluated at week 244, 88.7, 92.5, and 81.3% respectively achieved PASI 75 response. These data provide evidence of sustained efficacy in tildrakizumab responders and in patients switched from etanercept to tildrakizumab at week 28, and a favorable long-term safety profile with total tildrakizumab exposure of over 5,400 patient years. Exposure-adjusted rates of the serious adverse event were 6.3 and 6.0 patient with events in 100 patient years of tildrakizumab 100 and tildrakizumab 200 respectively. Patient underwent long-term treatment with two different tildrakizumab doses, allowing investigation of dose effect on safety. There were no apparent dose-dependent safety signal and no new or unexpected adverse events. In conclusion, tildrakizumab treatment provided sustained disease control over 5 years in week 28 tildrakizumab responders and etanercept partial responders or non-responder with a reassuring safety profile.